So my name is Ariel Garten. I'm one of the founders of Muse, and I'm excited to be bringing you today's webinar where we're going to be talking about clinician burnout. We're going to be talking about the tools and techniques that you as a clinician can use to manage your own burnout. And then we're also going to be talking about the impact of meditation and stress management techniques on your patients. So my name is Ariel. I myself was a practicing clinician as a psychotherapist in private practice for a decade, and my background is in neuroscience. And then I went on to build tools for clinicians and patients to help them manage their brain health. We build Muse, the brain sensing headband that helps you meditate and sleep. And our mission is to unlock the brain with tools that give you data and insights on what goes on in here, using clinical grade tools in an easy to access, consumer friendly manner. And I am absolutely honored to have our esteemed guest with us today. This is Dr. Robert Lewis. Hello, Dr. Lewis.
Hi. Thanks, Ariel. Happy to be here with you guys today.
Thank you. I want to give you a quick introduction so that everybody knows the awesomeness that is with us. So Dr. Lewis is a pioneering neurosurgeon, and he's also an advocate for clinician wellness. Dr. Lewis is the chief of the Division of Neurosurgery at Hoag Hospital, and he specializes in minimally invasive brain tumor surgery and microneurosurgery. Dr. Lewis is an innovator in the field, having established medical VR initiatives at Hoag and promoting novel ways to decrease post-operative pain and minimize neurological complications. So basically, when we say things like neurosurgery, Rob knows he is himself a neurosurgeon and here to talk about his experiences with stress management and burnout, both with himself, his nurse and physician colleagues, and with his patients. Welcome, Rob.
Awesome. Thanks, Ariel. Thanks for having me today. I'm excited to be here to share just a little bit of our experience and have an opportunity to help engage more of us in some learning some skills and employing some tools that might help with the battle that we all face as physicians. This kind of term of burnout is out there, and increasingly so. So just a little bit of background about me. I'm a neurosurgeon. Obviously, it goes without saying that that's a high stress job. There are kind of a couple of different, ways that, surgeons take to deal with that. One of the things I always say is, we, by nature of our profession, have huge egos. So, you read, you'll see books out there like, by Ben Carson, Gifted Hands, where they write about how great they are. And so, one mechanism of protecting ourselves against, let's say, the trauma of taking care of patients who don't always do well or have complications or who die, whether by natural history or by, surgical mistakes. One of the defense mechanisms that the ego can use is narcissism, to just think, yeah, you know what, that's not my fault. It's not, I'm so great, and this is their problem, and this is what happens. And this is where, like, a book like Gifted Hands, to me is a little bit off-putting. Henry Marsh is a neurosurgeon in England who tells a very different story. And he wrote a book called Do No Harm. And his book is essentially the opposite. It's about how, that we all, the best surgeons in the world, the most technically gifted, the Michael Jordans of surgery, make mistakes. Sometimes diagnostic mistakes where we miss things, sometimes technical mistakes where we, our hand moves in the wrong direction by a millimeter, and those mistakes can have catastrophic consequences. Even with the best practice and preparation and training, we all have mistakes and complications. And the only way we can, get better is by paying very close attention to those and developing strategies to help us be able to improve with time. And that's why they call it the practice of medicine, because we are constantly trying to practice and improve. So Henry Marsh's book, which is I highly recommend, is essentially at the end of his career of basically saying, how do we do this and stay sane for a lifetime, for 30 years of doing things when, as my mentor once said to me, he's like, someday you will kill someone. He's like, a mistake that you make in surgery will kill someone. And how do we continue to recognize that there's still a greater good that we can serve? How do we stay sane for the full length of a career and not leave practice because of a single mistake? Because to be honest, in our minds, a single loss, it outweighs 1,000 wins. So I remember every single problem, whereas it's hard to remember all of the people that you've helped along the way. This was a problem before COVID, and not to beat a dead horse with the impact of COVID, but the impact of COVID on physicians and nurses can be compared to the impact of veterans in the Vietnam War. That we were out there putting our own lives at risk and fighting a battle. Even those of us that weren't directly involved in the care of COVID patients suffered the consequences of seeing the impact of this on the population. So all of this as a little bit of a background is to, kind of lead to the fact that one of the tools that I have learned to engage in order to stay sane and keep in the fight is that of mindfulness and meditation. Where's my video? The host has stopped. Okay.
So we see a compelling photo of you in your surgical.
Okay. Something happened to my video. So one of the tools that I've learned to help me with this is that of using meditation and mindfulness. Of course, there are certain things we know that we can do to impact brain health. The number one thing is physical exercise. Physical exercise on a regular basis is the number one thing that we can do to help with anxiety and depression. So obviously staying physically active is key. Among the top things, I believe, is mindfulness and meditation. And so Chris Ahmad is an orthopedic surgeon for the New York Yankees, and he wrote a book called Skill, where he compares the skills and preparation and training of elite athletes and musicians to those of elite surgeons. And he came to this experience because he's the surgeon for the New York Yankees. And so he operates on these elite athletes, and there's a lot of similarities, the preparation and training in years, Malcolm Gladwell's 10,000 hours to become expert at something. But the one major difference that he puts into it is that, there is for athletes, there is practice that occurs even when they're professionals. Even when Michael Jordan was 6 times world champion, he's still shooting free throws by himself in the gym when it doesn't matter. Whereas as physicians, we don't have the ability to do this. So this kind of led to my working on the development of technology in order to allow physicians to do this. So I was involved with pioneering a virtual reality program, which is based on flight simulation technology for F-16s, which was adopted from the Israeli Air Force. And rather than using it to prepare for a flight, a fighter jet mission, we now have adopted it to be able to use to visually and mentally prepare for brain surgery, so that we can have a mental representation or a practice, the practice of medicine, except rather than practicing on a human where a mistake can be permanent, we can practice on a computer system where we can make a mistake and reset it. And so this became, as we developed this technology, part of my preoperative routine. And then immediately after that, right before we kind of do the timeout, I go from the mental scientific preparation for the surgery to the mindfulness moment. The timeout in surgery has become kind of a checklist of things, but before that, in my mind, the timeout is the moment of pause. And this is kind of, I think, in my mind, in all of life, the ability to introduce a moment of pause is a skill that, whether it's surgery or parenting or flight or almost anything, the ability to introduce the moment of pause. I'm going to get the quote wrong, but it goes something like, between stimulus and response, there is a moment. In that moment lies our ability to choose our response. And in that ability to choose our response lies our ability to completely control our future. And so this is what we're talking about, is the ability to systematically introduce that, the moment of pause between stimulus and response. And whether it's a moment or 3 minutes or 5 minutes, it doesn't really matter, but it's the practice of that, of introducing that pause, of not reacting, of not hitting the tennis ball back, but deciding where this shot is going to go, that can really make a difference in the outcomes in our ability to, for lack of a better word, manifest our own future. So several years ago, I came across the Muse device, long actually, like even when I was beginning as a neurosurgeon, and I loved the idea of the feedback. I'm a data guy. I'm not looking to make myself, I'm sick and get well. I'm looking to take myself from a top 1% to a top 0.1%. So any data that I can have that can give me the ability to get that extra edge, which will benefit my patients, is valuable to me. And so that's where I was immediately interested in Muse, because using the brain waves, using biofeedback to guide meditation as a tool is another way that we can train our brain to get better and better at that skill set. And so this is kind of where this all started from.
Amazing. So you've taken us from being terrified at the moment of neurosurgery. You may not be terrified, but I was terrified in the description. One slip of the hand could be fatal, to the practice of bringing in a pause, and then to technology that can help you with that pause. I'd love to dive in a little bit and kind of go into that moment before you're about to go into surgery. And what is it like? What do you do? How do you engage all of the staff around you? Because it's a team effort. Can you sort of share that moment and how you bring everyone into calm and alignment?
Yeah, so the program that that we follow initially, so there's the airline industry has an immaculate safety record. I mean, we hear about occasional crashes, but for the number of people that fly on a daily basis, the number of people that get hurt is infinitesimally small. By comparison, hospitals overall, even the best ones, that the safety record is terrible. The number of medical errors that lead to harm is very, very high. And so there's a program that was adopted from the protocols for airline safety called LifeWings, which essentially takes the process that they use in flight preparation, that they go through the plan, and everyone on the team is empowered to say, no, let's stop, this is a problem. So we started off with, we revamped our checklist, our timeout process, to not just okay, is this the right patient in the right arm? But I vocalize it with the team. This is the plan for the surgery. This is a 7 out of 10 difficulty surgery. The areas that I'm worried about are going to be this and this. The possible complications are this and this. You can see this here on the screen. We've got integrated operating rooms which show everything, so that everyone on the team can see exactly what's going on. And I explained that to them over the course of 4 or 5 minutes before surgery, so that I know that they know what parts I'm worried about, what things could go wrong. And I also tell them, hey guys, if at any point you feel like I'm getting frustrated, or you feel like I need a break, please feel free to speak up and tell me. I empower them to essentially stop me, like, Dr. Lewis, it's been 8 hours. Why don't you take a break? Like, it seems like you're getting frustrated. Because as the captain of the ship, my mentor, who's the best surgeon I've ever seen, Ed Oldfield, who has since passed away, I could never in my life aspire to be as good of a surgeon as he was. And what impressed me the most about him was that when things got really bad, when the plane is about to literally dive into the Hudson, he was as calm as he could possibly be. As things got worse, he got more calm. And I tried to, over the course of my career, work towards developing that. Because if I'm panicked when there's a problem, everyone else in the room is going to panic, and that doesn't help anyone. Panic is a useless, a useless state. The sympathetic nervous system, which is the fight or flight response that exists in us is what gets activated when we are afraid. Now, this exists from the period when we were running away from lions on the savannah, and it existed for a reason. If your life was in danger, you needed to activate. You either needed to freeze or run as fast as you could to save your life. That system has gone essentially unchanged until this present day, except in the modern era, the actual threats to our life, the things that we should need that system to activate for, are almost never. The number of times on a daily basis where your life is literally in danger and you need your sympathetic nervous system to be charged up and on is zero. But it still exists, and so it gets triggered rather than by perceived threats to life, rather than by actual threats to life. It gets triggered by perceived threats to life. In the case of stress, it could be the perceived threat of losing a relationship makes you feel like panicked, like you're going to die. You're not going to die from that. And so we have to learn to recognize the physical symptoms that the sympathetic nervous system is activated and learn to deactivate them. In the case of surgery, if my patient could die, I injure the carotid artery, and literally I have 2 minutes to repair it, or they're going to bleed to death. If I panic and start to shake and start screaming and yelling at the staff, I'm going to miss the window in order to save them. Whereas when the things get really bad, the more ability I have to calm myself, the more likely I'm going to achieve the outcome that I want. So instead of, oh my God, we've got an injury to the carotid artery, it's, hey everyone, listen, we have a serious injury here. I need everyone to pay attention. I'm going to need this. Please, can we get an extra suction? It takes me the same amount of time to say those things, but my reaction of being calm keeps everybody else in the room calm, and they don't panic. We don't make good decisions when we're panicked. We make good decisions. We respond well when we are calm. The Navy SEALs will say, slow is smooth and smooth is fast. So that if we move and think slowly just for a moment, then we can ultimately have a better outcome. So training myself to do that is really what this has been all about. And there are, of course, many ways to do that, but I like to have multiple tools in my tool belt. And it's for many, many people, when I recommend meditation, they say, yeah, I just can't focus, or I don't know if I'm doing it right. And that's really where a device, the Muse device, shines through, because people just they doubt themselves, and then it becomes almost a stressful situation when they're meditating, well, I'm not doing it right, or I'm, the practice is what's helping them, but getting feedback that progressively the brain can learn over time is really a valuable tool. It's because people want to see progress, and they want to see that some kind of feedback that they're doing it right. Otherwise, they'll give up.
So how is it that you personally have gotten yourself to the state of extreme calm? I mean, you're describing something that sounds so untenable. You're in this unbelievably stressful situation, and your anxiety should be rising and rising, yet you, while paying attention, while being engaged, while managing your team, are also calming yourself. How do you do that?
It's the brain is a muscle. Each aspect of the brain is a muscle. So if I want to work my biceps, I need to do bicep curls. If I want to work my calves, I need to do calf exercises. So if I want to work on short-term memory, I have to play memory games. Sudoku, for example, doesn't help with memory. Everybody's like, well, I want to improve my memory. I do crossword puzzles and Sudoku, but those aren't memory games. So they're not going to help your brain with short-term memory at all. If you want to work on short-term memory, you have to play a memory game. If you want to work on focus or attention, you have to use a system or a game or a program that focuses on attention. If you want to work on mindfulness, on presence, you have to specifically train that muscle. And you can't train it. Soldiers don't train by just getting dropped off in a war zone. They train first in a safe area where they can learn their skills when there isn't pressure, and then progressively introduce the pressure and their ability to use the skills that they've learned in where nothing is at risk. By comparison, when I'm practicing in virtual reality for surgery, then those skills, the muscle memory or the brain memory, the skill set will progressively apply to situations where we are under stress. And again, so in my practice, it is the first thing that I do that I wake up in the morning is my meditation practice. And it is, I was advised, I used to do it the first thing I wake up. Now I've been advised, have my cup of coffee first so that I'm not kind of sleepy. So I'm alert and awake. So I wake up, have my espresso, and then I have my meditation practice. And what you see over time is that this practice, you'll feel the first couple times you do it, you'll feel calm right after, and it's going to be different every day. But the practice over time is building that muscle of being able to calm the storm in your brain. And I use the analogy of the storm. The sympathetic nervous system is the storm. We need to be able to, and we absolutely can, consciously downregulate, turn that storm off, no matter how loud it gets. So we can, there's medications that can do it, but those only cause a worse problem. If I have a panic attack and I take, a Ativan, yeah, it'll calm the panic attack, but then once it wears off, I'll be more likely to be panicked. So instead of medicating it, we, teach a skill rather than giving a pill. So the skill of being able to calm the storm in your mind. I mean, maybe just because this is my world, but there are a few situations that are more stressful than brain surgery, and so it is of critical importance to me, for my sake and my patient's sake, to be able to have that skill finely honed. Arguably as important as me knowing the anatomy of the particular approach or surgery that I'm going to do, because the knowledge goes out the window. Your frontal lobe, where we think and plan and are human, is deactivated when we're in our sympathetic nervous system. All we're thinking is, I got to get out of the situation. So the ability to downregulate the sympathetic nervous system or turn off that fight or flight response is really what we're talking about here with all forms of meditation. And using the device where we have objective biofeedback to tell us that we're doing that correctly, or that we're making progress in that, is, to me, invaluable, because it takes kind of the guesswork out of it. It takes the "am I doing this right" out of it, because although nobody, the Buddha wouldn't be able to keep it on quiet all the time, the goal is progress over time, and progress, not perfection, is what we're looking for, because it's the practice, not the end goal, that we're looking for. The more we practice anything, whether it's surgery or music or basketball or meditation, the more we practice anything, we're going to improve. However, one of the areas where I kind of disagree with Malcolm Gladwell, as far as the 10,000 hours, is that, he makes the argument that 10,000 hours and you become expert at something. Let me counter that by saying we've all driven 10,000 hours in our lives, and arguably most of us are not experts at it, and we don't become more expert at it over time. And the reason is because we are not practicing with the intention to improve. And so it is the biofeedback mechanism that gives us the feedback of that, yes, we are improving, or no, we're not. And therefore we can intentionally practice with the intention to improve, that allows true progress over time. And to me, that's really, again, where the Muse device stands out, and I'm sure that's why the mechanism has supported the data, such as the data that coming out of the Mayo Clinic, demonstrating the significant reduction, more than 50% reduction in physician burnout when using the Muse device. We're talking about 3 to 10 minutes a day. These are physicians at the Mayo Clinic, probably the best medical center in the world, and more than 50% reduction in burnout. That's that by itself stands as a remarkable testament to the power of meditation. And could that be achieved on your own if you were a skilled meditator? Yes. But why not arm ourselves with the tools to help as many of us be able to get there as possible? Because this is a real problem. I read an article the other day that said that suicide among American surgeons is at the highest rate that it has ever been in the history of our country. Physicians killing themselves. One of my colleagues here in Orange County, a neurosurgeon, in the last month committed suicide. It's hard to stomach that. These are people that spend their whole lives trying to help people, and it could be one mistake that leads them to feel that they're a failure, even though they may have helped thousands. And if there's a tool that we could save one life, one physician from this kind of outcome, I want it to be available to everyone. And that's kind of where my initiative to provide this to our physicians at Hoag came from.
Yeah, wow. So you've just shared a lot of really impactful information from, your own methodologies to calm the nervous system. You've convinced us that it is all possible. We can train, and we can train that effectively to be able to be sufficiently at self-regulation to be able to perform very difficult tasks. Probably people might be wondering, you've mentioned Muse a lot and this thing that you use. I'm gonna actually take a moment and just talk about what it is for anybody who doesn't know. I know a lot of people on the line are yourselves clinicians that use Muse with your patients or yourself, or you're our Muse community. Some of you may not know what it is. So this is the Muse here. We have two of them, Muse S, Muse 2 and Muse S. Muse is a clinical grade EEG. It has 4 channels, 2 channels frontal, 2 channels temporal, and it tracks your brain in real time. We have a range of different applications for the Muse. What Dr. Lewis has been discussing today is the meditation application, and it gives you real-time feedback on your brain while you meditate. So you slip on the Muse device, and during your meditation, it gives you audio feedback to let you know when you're focused and regulated and when your mind is wandering. And so you're getting real-time audio cues to know when your mind is stormy, and then that becomes your cue to bring yourself back to focused attention. So Dr. Lewis has been using the Muse for many years, and Mayo Clinic brought it into their practice with their physicians. They demonstrated, as Dr. Lewis said, a 54% reduction in burnout, and also improvements in resilience, decrease in stress, improvements in cognition while using the Muse. And Dr. Lewis then started a program at Hoag Hospital, making Muses available for any physician that wanted it in order to be able to help his colleagues manage stress and burnout themselves. Rob, do you want to share a little bit about that?
Yeah, absolutely. So, as I've said, one of my big interests is in neurotechnologies, advanced technologies, both for the performance of surgery as well as personal performance, personal wellness, pain management. So I'm very involved in developing and testing and implementing these technologies, and wanting to be on the cutting edge of some of these things. So this kind of went back to when we started using the virtual reality to simulate surgery, and we were having so much success with it that the patients started asking, hey, listen, that's my brain, can I see? So then we put in the VR headsets on them, and then it was helping the patients become less anxious before surgery. And so then our CEO said, Rob, what other technologies are there out there that could help, in the kind of space of immersive technologies, biofeedback, VR, AR. And so I started investigating that, and there were a couple of big opportunities that came out of that. one of them is in the chronic pain space. We lose 100,000 Americans a year now to opioid overdose, and it's because there aren't great solutions for pain. One of the great things that can help with pain is pain neuroscience education and combining it with meditation. So the understanding of the source of the pain, as well as, again, down-regulating the sympathetic nervous system to decrease the reactivity to that pain. And so coming out, I was, because of my work in this area, I was given a grant of $1.5 million as an endowment to further my work in the advanced technology, neurotechnology space. It's called the Empower 360 Foundation. And essentially what this does is it's an endowment, so it allows an annual expenditure of money for projects that I feel could be beneficial to our patients or our community. And so coming out of COVID, this data coming out of high physician suicide rates, of significant burnout, I've seen some studies that say that 40% of physicians are considering leaving the active practice of medicine in the next 2 years. That is if that actually happened, we would have a crisis. We already don't have enough physicians. It takes 15 years and $1 million to train every physician, a neurosurgeon even more, and so each one we lose, we're not able to replace. And so anything we can do to keep those doctors in the fight, helping patients and help them stay healthy themselves, is critical. So this year, based on my own experience with the Muse device and my own experience with it helping me improve my meditation practice, using the funding from my endowed chair, I created an offering for physicians, which included 3 different options for mindfulness and meditation. One was we have a mindfulness coach, so funding small group sessions of guided meditation with our mindfulness coach for physicians that are interested. Another one was a virtual reality based solution using VR guided meditation by a company called Behavior, which offers VR guided mindfulness and pain solutions. And then the third offering was the Muse device. The idea being that there's no one-size-fits-all solution for everyone. That some physicians would love technology and want to use it. Others like the VR because it gives them a visual component. Nature is one of the best healers that there are, but we don't have ready access to it. So sometimes a virtual reality trip to Zion, where I was last weekend, is what we need. But what we found, I've offered all 3, but by far the most profound response has been the interest in the Muse device. So we started off with a small allocation, and we have been unable to keep up with the demand, so that now we have I believe it's 500 of the devices out to our physicians. And so we have 1,800 physicians on staff. So almost a third of them now have entered into picking up the devices and started to use them. And this is actually I haven't even shared the data from the Mayo Clinic showing the benefit yet. So this is just interest based on kind of our discussions of it. But the interest from the physicians has been overwhelming, and it's been one of the most successful programs that we've had to date as far as engaging a number, the pure number of clinicians that are interested in using this across the board. It's been going on, I would say we started not even 6 months ago. And so, to have this level of buy-in, there's no other program that we have that 30% of our physicians participate in. So far, the idea in introducing it was as the, I didn't want this to be okay, we're having an ask of the physicians, like, yes, use this, but we also want you to do X, Y, Z. My intention was as a gift, as an offering for my colleagues who I care for and who I want to keep healthy, to provide them with a tool that may help them to continue the ability to care for patients. I think eventually we would love to start studying the impact of that as well, like as the Mayo did. so far, what I've been aiming at is just purely from an altruistic standpoint. Let's get this resource out there to help as many of our docs as we can.
That's absolutely amazing. And I mean, we didn't know anything about the program. We only got a post hoc email from Dr. Lewis saying we ordered Muses, and by the way, the doctors love them and they're all out. Can we have 200 more? So it was, quite the surprise to us and quite amazing. Noah, could you please share in the chat the link to the Mayo Study? So Noah's about to share the link with the healthcare professionals. So that's nurses, doctors, clinicians at Mayo using Muse. There's another fascinating study that Mayo did in 2017, long ago, with an early version of the Muse, where they looked at code teams. So they put together code teams of nurses, doctors, a pharmacist, and had them ready to respond to simulated codes. And what they demonstrated was meditating using Muse, they improved their time to resuscitation and their harmonization across the team. So that, that's quite amazing. So when you describe the experience of getting all of your staff ready, taking that moment, getting everybody on the same page, the evidence continues to bear out of the power of it.
And we actually, in the operating room, I go from, like, for 3 minutes, I go from all the images of the brain and the EEG and all the beeping and bumping and things, the noises in the OR. We go to all the screens turn to a waterfall scene. And the whole room is like there's 10 screens all playing a waterfall, and everybody, the eyes closed, eyes open. I mean, this is the moment, that kind of we say, okay, we're about to do something serious. Let's just take a moment here. In the operating room, it isn't using the Muse, but the daily practice in the morning, is kind of what led to our ability to carry that over into the operating room.
Amazing. We've talked a lot about the clinicians and our own use of Muse. Can you talk a little bit about patients and the value of meditation for your patients and how you may engage them in the action?
Yeah, so I mean, as a neurosurgeon, I do mostly brain tumor surgery, but patients all the time are asking, well, like, what about this? I'm starting to experience memory decline, or what can I do to optimize? And so I have a kind of general, highlights for brain health of what we do. So we have, based on the work that I started several years ago, we have built an immersive therapeutics laboratory here at Hoag, which is kind of where I do a lot of the technology development, including VR and AR technology for practicing surgery, also using virtual and augmented reality for treating pain, for cognitive evaluation and rehabilitation. And so we have a dedicated space for that, where patients can come and experience these technologies. And so when I'm speaking to patients, when they ask me, what things can I do, essentially, I list off, 4 or 5 things. Number one, physical exercise is, we know, the number one thing you can do for both physical and mental health. Number 2 is the importance of sleep. Sometimes that's paired with the ability to calm the mind and the sympathetic nervous system. The importance of meditation itself. The sympathetic nervous system will kill us eventually. The elevated heart rate, the fight or flight reflex is not necessary in 99% of daily life anymore, unless you happen to step in front of the bus and need to jump back, or happen to be in the savannah and there's a lion coming at you. Most of the time, we don't need that sympathetic nervous system. And so we need to learn actively how to turn it off. So physical activity, sleep, mindfulness and meditation, of course, nutrition. I always tell people, what things it's more important of what they add than what they take out. I give a kind of small list of things. And then the most recent one that's come out is the importance of social interaction in preserving cognitive health. So mindfulness is kind of a solitude thing, a solitary thing, although there are group meditation, things. For me, it's a solitary practice, but the importance of social interaction is also critical in maintaining and preserving brain function, because we humans are social creatures. So isolation leads to cognitive and emotional decline. So that's the kind of overview that I give to patients. And then we try to make available just by guidance of, these are the tools that I recommend. For example, one of the things in spine surgery is posture. Well, there are t-shirts that can help you work on your posture. For pain, there is a virtual reality program that is now approved for treatment of low back pain. For mindfulness and meditation, it's the Muse device. That this is an easy to use way where when patients always, I suggest meditation, like, well, I've tried it, I just can't do it. I said, okay, maybe you need a little help, to get you there, because it's just sometimes daunting to people. These are almost every patient, whether it's before surgery or after, we have these conversations, what we'd like to get to as medicine, at least the general thought or the overview of medicine, really is progressing from treating disease or dis-ease to wellness, and not only prevention but optimization, that more and more patients should have access to these kind of devices. So ultimately, if there are things that can help patients manage their high blood pressure, hypertension, for example, there's data that shows meditation helps lower blood pressure. So it would make sense that we could eventually get to a point where the devices could be, like the Muse, could be available as a medical device to help with certain conditions. Now, is it going to help with, I'm trying to think of something, where, like an asthma, for example, probably not, a reactive airway disease or something, but there's few of those. Actually, one of my colleagues that, talks about is an old Irish neurologist, and he uses the word dis-ease rather than disease. And he says that something like 80% of all human pathology is related in some way to stress and the mind-body connection. And so if you think about the power of that, our ability to go from dis-ease to ease can help in far broader terms than probably we're even able to understand.
Amazing, Dr. Lewis. Thank you. We have 15 minutes left, so I want to make sure that we have time for questions for the audience. I'm going to do a quick wrap up and then open it up to Q&A. So Dr. Lewis, this has been unbelievably insightful. You've taken us all on an adventure into your mind and into the mind of somebody who is responsible for, the brains of many. And thank you for sharing the various tools and techniques and methodologies that you've used. To the audience, we're going to now move to audience questions. Dr. Lewis, I hope you'll be able to stay with us for a few minutes to be able to answer. Awesome. You can feel free to put your questions in the chat or in the Q&A, and Noah will be good enough to ask the questions and we can answer them.
Yeah, Noah, thank you so much, Dr. Lewis. That was incredible. And the first question we had early on in today's session was from Maiden Begrade. Are there any contraindications for using mindfulness in the general population?
So for mindfulness, absolutely not. It is there's no condition under which mindfulness is going to, hurt anyone. I cannot say specifically whether there might be contraindications for the Muse device, although I believe not. You guys may have some, something of that, but to my knowledge, there would be no contraindications. There are definitely no contraindications to a practice of mindfulness at all.
So that's unlike most medical interventions.
Absolutely right. Even exercise, there are conditions, under which physical exercise may be contraindicated if the patient is, the heart cannot tolerate it. I cannot think of a condition which would preclude the practice of mindfulness where it would cause any harm whatsoever.
Amazing. One of the things that we've noticed with meditation with Muse is that often people who have anxious thoughts and feel they have difficulty with meditation because they sit down and they get greater sensations of anxiety while they are meditating because they're alone with their thoughts. The practice of using the Muse actually reduces that experience because they're hearing audio throughout it, and that audio kind of sort of blanks out the content of the thought. So you're no longer sitting there with the content of the thought, you're merely realizing, oh, I've had a thought, let me shift my attention. And so we actually,
there's a reason for that. So when our eyes are open in the waking state, 90% of the input to our brain is visual, 8% is auditory, and 2 to 3% of the remainder of your senses. When you close your eyes and you turn off the 90% stream, it opens up the other senses, and also the default mode network, which goes to the worrying and the thinking, and that's why those things open up much more. And that's why so many people have a hard time with meditation. So if we're turning off the visual stream of information, we have to fill that back with something. And in the case of white noise, otherwise, it can become very easy to have your thoughts get away from you. So that's why, to me, the pairing with the auditory, particularly because I love the storm analogy of panic. It to me works so well.
Awesome, thank you, Dr. Lewis. Noah, next question, please.
We had a question. We get this actually not just today, but oftentimes from clinicians and practitioners. What are some of the best ways to implement Muse to get started with your practice?
Just do it. I mean, just put it on your calendar, put it on a reminder. So I've just finished reading the book Atomic Habits, and you have to have, in order to make something a habit, it has to be obvious, it has to be in front of you, you have to trip over it almost in order to create a habit. And so I set my alarm in the morning that 5 a.m. my alarm goes off to wake me up. I get up and have my coffee. 5:15, my alarm goes off. Meditate. So if I decide that I want to start jumping on my computer and checking emails, and I distract myself, the alarm again reminds me. You know what? Nope, it's time for you to go back to this for yourself. So building in a specific time that's set, that cannot be interrupted. There is no person in the world that cannot put 10 minutes aside a day for themselves to meditate. And although I would say that exercise has the most beneficial effect, and you got to get to 30 minutes for that. That should be dedicated time. Not myself as a neurosurgeon, no one can't find 10 minutes in the day. It's a matter of making it a habit and setting as time. I have a specific time. There's a specific area that I have set up for it. Removing all of the obstacles to doing it, having the device charged and sitting there ready to go, so that all you have to do is go sit and put it on, and you're ready to go. After a while, that will become habit. So you may not need the cues, but even when you go on vacation, you want to have as to the extent possible, those same cues available to remind you to, again, almost like you have to trip over it. That like you can't get out the door without doing this. Don't make it non-negotiable. It really is what it is. This is time you deserve for yourself, and I guarantee you will benefit from it.
Amazing, thank you. Noah, next question from the audience, please.
Yeah, this is one from Alicia Abundes Gutierrez. What were the most difficult challenges have you experienced in the process of implementing the program?
So I guess the thing would be for myself or for our physicians. So far, for myself, it's just again a matter of practicing it, and then getting through the first week or two. You'll actually very quickly start to notice the benefits extend into your own life. I mean, it doesn't take long, with having, meditating daily for a week, you'll start to, yeah, sure, at first you'll feel calm right afterwards, but you'll start to notice, like, you'll get less frustrated. Like, my daughter will say something that I would otherwise, and I'm like, you know what, I'm upset because of me, not her. Like, you'll start to notice the benefits of it. As far as implementing a program, I was fortunate enough to be able to have funding to allow for this, for our physicians. But many hospitals have these kind of resources, or at least have resources available for physician wellness because of the pure cost of losing a single physician for practice. That you could give the device out to 1,000 physicians. If you prevent losing one of them, it's worth the expense. So there are a lot of physician wellness programs out there. Few of them are evidence-based, and with the Mayo Clinic study, this is now an evidence-based solution. So you can't control behavior, but physicians love data. And so, I had these 500 physicians sign up to using this device. This is actually before I even sent out the data from the Mayo Clinic study. So I'm assuming that in the next couple of days, we're going to get a further increase in the influx of requests, because now that they're saying, oh, you know what, maybe I should give this a try too.
Amazing. And Alicia, to further answer your question, we also have mechanisms at Muse to help you manage a program with doctors, nurses, clinicians, naturopaths, etc. We have a dashboard that allows you to track the usage if that's appropriate. We also have tools that you as a clinician can use with your patients. So the Muse can be used and recommended to your patient. The patient's compliance can be tracked along a dashboard. You can offer bespoke programs of meditation, sleep, stress reduction, mood to your patients and your clients, and help them manage. And then we offer a discount on Muse to you as well, so that you can do the practice along with your patient.
And I would be happy to be available, if there's a hospital system interested, in kind of implementing a program like we have at Hoag. I would be happy to kind of meet with the key stakeholders and help kind of, share our experience. That's something we could set up, because sometimes it just takes, an understanding of how it's been done somewhere else, or, a physician champion to make a difference.
That's awesome. Thank you so much, Dr. Lewis. I think we have time for a couple more questions. It's 2:54. Noah, next one, please. And let's try to get a few more questions in quickly.
Yeah, this one's really quick. Ariel, you might be able to speak to this. Can someone with a pacemaker use the Muse device?
Yes, they can. There's no contraindication.
Very, very good. And there's another one that I think, Ariel, you might be the expert as well, Dr. Lewis. Is it true that mindfulness would increase size of some parts of the brain, but reduce size of neighboring ones?
So go ahead, Ariel.
I'll take it super quick. So mindfulness has been demonstrated to maintain the thickness of the prefrontal cortex, maintain the size of the hippocampus. Stress creates, shrinks your hippocampus. The antidote of meditation seems to maintain the size of it. It's shown to increase the size of areas of your body responsible for proprioception and touch and sensation. And it's also been shown to decrease, and this is probably the one trick question, decrease the activation of the amygdala in shorter term meditators, and even the size of the amygdala in longer term meditators.
So I'll just add a little bit to that as well. So it is specifically the stress hormone cortisol that is toxic to the CA1 cells in the hippocampus, which are the ones specifically responsible for making new memory. Those cells in the hippocampus, the cortisol is poison to them. And so meditation, we know clearly lowers cortisol levels, and therefore decreases the toxicity associated with that, particularly with regards to those cells in the hippocampus. There was a question about, can it increase the size? Nothing we do can grow the size of the brain. You're born with a certain number of brain neurons. They are dying off from the day you're born until the day you die. So nothing we do can increase that number. All we can do is preserve as many of them as we can, and particularly in those areas that are important for cognition and memory. Whereas the amygdala is the kind of reptilian, fear-based thinking brain. So we kind of want that to shrink off. And so that's exactly what Ariel was saying, that preserving gray matter volume, both through physical exercise and meditation, is what we really hope to do over time.
Amazing. So I'm going to wrap up the webinar now, and we're going to say goodbye to our excellent guest, Dr. Lewis. I'm going to remain on the line for anybody who has additional questions. So if you have more questions, you don't have to run away, but Dr. Lewis probably has some brains to go operate on. So I want to thank you so much, Dr. Lewis, for your time and your attention, sharing your knowledge as well as your personal story. And it's been incredibly inspiring being able to hear the ways that we truly can self-manage.
Thanks so much for having me, Ariel. I appreciate it, and I look forward to talking again soon.
Thank you.